dear my friend. This is Samuel Sane from East Africa, Kim's Hospital representative. I want to introduce a hepatologist today to you. I'd like to tell my doctor and my friend to say hi to you.
Hi, my name is Dr. Chandan Kumar. I'm a hepatologist. You can say in simple language, a liver physician, a liver doctor, to be more simple.
Liver doctor.
A liver doctor
Or hepatologist.
in Kim's Hospitals, Hyderabad.
Great. Doctor, for how long have you been practicing this specialty?
More than 10 years.
More than 10 years.
Yeah, actually 15 years to be more specific.
Where did you go for your studies?
I did my basic training in Manipal, Mangalore and Karnataka state. And I did my super specialty training, that is a liver training in Delhi. Then after that I did short training in King's College London for liver ICU, and I had done transplant training in Mount Sinai Medical Center in New York.
Wow, in New York.
In New York.
London, New York.
Yeah,
Manipal.
and then back
Manipal
to
is in India.
India.
Yeah. Great.
Yeah.
That's nice.
Yeah.
I want to ask you a question.
Yes, please.
So many people don't know the function of a liver.
See,
Can you tell us?
Yeah. So liver, if you keep it very simple, liver is like the factory for the body. For the human body, it's a metabolic factory. It's a chemical factory. It's the largest solid organ in the body. Internal organ. The solid organ is skin. The largest internal organ in the body is liver. And it does whatever we eat, food, or we eat medicines, or we eat any supplements. Everything is digested by the liver. It's absorbed in the intestine. The glucose, protein, all that is broken down in the liver, and it gives all the supports to the body. It provides immunity to the body. It provides it's a largest source for immune system. It provides all the nutrients. It removes bile. It's like a it's like a complete factory.
I have a question. What is the relationship between the liver and the kidney?
It's like a brother and sister.
Tell us.
So if a person has normal kidney functions, but liver is getting worse, that kidney will start getting worse. But from that same patient, if you take out the kidney and put in any other patient, it will work perfect.
Yes.
So slowly, because of the liver function, when it starts deteriorating, the first organ to get affected is the kidney, and then heart, then lungs, and then finally brain, and that's how patient dies. Many of them, they also get liver cancer also. But in liver disease, even when we talk of transplant also, what we see as physicians is the medical fitness of the patient. And one of the important parameters is kidney.
Kidney.
Yeah.
Is there any relationship between the liver and the brain?
So that is called hepatic encephalopathy, which the liver, when liver starts failing, there is some production of ammonia. It's a product of the protein metabolism. It's converted to urea, which is a non-toxic metabolite, which is excretes through the urine out.
Yes.
But when the liver starts failing, that conversion from ammonia to urea does not happen, and then ammonia goes from the intestine to the brain. So that's how they develop that confusion, coma behavior, and they go into that altered mentation. They have, like, they sleep in the day, don't sleep in the night, they keep forgetting things, and they talk irrelevantly, and finally they go into coma. That's how the brain is affected. And over a period of time, if the ammonia continues to rise, there will be permanent changes in the brain. That is called chronic portosystemic encephalopathy, which slowly, with time, after transplant, it starts becoming normal.
Oh, I remember sometimes back 2012, 2011.
Yes.
My father was sick. He had colon cancer.
Okay.
Though he passed, may he rest in
Okay.
peace.
Okay.
No, I remember he was suffering. The cancer spread all over to
Yeah.
liver
Yeah.
and also
Yeah.
to lungs.
Yeah.
I remember he had a lot of confusion. He could not remember anything.
Yeah. Yeah. That's
So that is
part
what
of the liver
happened.
disease. Yeah, that's right.
And when someone takes alcohol
Yes.
at highest level,
Yes.
is the same issue that happens to the brain?
Yes, that's right. There are two types. So suppose if it can be alcohol withdrawal, which will also produce symptoms like this only, or it can be liver dysfunction. So both causes the same symptoms in the brain.
Okay, doctor, let's continue
Yes.
with this issue of hepatologists.
Yes, please.
Is there a difference between gastroenterologists and hepatologists?
So gastroenterology is the mother subject. Like the main subject is general medicine. From general medicine, cardiology, pulmonology, gastroenterology, neurology, psychiatry, all those things have come. In gastroenterology, one super specialty or one subspecialty can say is hepatology. Like for example, now how the science is revolving. Like we have specific doctors for pancreas, we have specific doctors for inflammatory bowel disease, we have specific doctors for liver. Because now liver, those days when we were studying, that time the hepatology or the transplantation was it was a nascent stage. Now it is an advanced specialty, and it is a growing specialty, and there's a lot of unmet need for that. And that's the reason hepatology, like we don't have much focus on endoscopy or gastroenterology work. Our main focus is on hepatology and transplantation and post-transplant care. That itself is a full-time job.
Oh, great. Now, do you know the types of diseases that affect the liver?
Yes, yes.
As a doctor, kindly tell us.
So one is like commonly what you said is alcohol, which causes liver disease. Second is fatty liver, which is becoming very common nowadays because of our sedentary lifestyle and diet and all that. And next common is hepatitis B, chronic hepatitis B, chronic hepatitis C, which come from blood transfusions. Then comes your genetic disorders like Wilson disease in children, autoimmune diseases. They all come down the line. And the Budd-Chiari syndrome, that is where the veins block in the liver. These are all different causes. So in that major chunk, 50% you can say alcohol. In the remaining 50%, 40% is fatty liver, the next common. Yeah. And in the next 10 years, what the data says is fatty liver is going to overtake alcohol also. It's going to be the number one cause of liver disease in the world.
According to me, I know some two issues that affect the liver. I don't know whether you can elaborate more about them. There is biliary atresia and also hepatitis.
Yes. So any disease, any damage to the liver like alcohol, fatty liver, so it causes is hepatitis. Any damage in the liver is called an inflammation in the liver that means hepatitis. Uh, Biliary atresia is usually seen in children where they are born with absent bile ducts. So they'll have jaundice from birth.
Yes.
And they'll have white colored stools. And slowly with time they start developing liver disease within less than a year of age. So that for them the treatment, if you find out biliary atresia less than 3 months of life, we can do something called Kasai procedure where we join the intestine to the liver, by which we can buy some time till the child grows a bit in weight. But eventually the child will require liver transplantation. Without liver transplantation, biliary atresia cannot prolong forever.
Yeah, it's true. I know a certain baby who was here, and it's already, the baby was already, there was a delay, and the baby had to pass.
Okay.
But no problem. There's also another disease I learned somewhere, allergy syndrome. What is
Yeah.
that?
It's basically a genetic defect where they have multi-system involvement, heart involvement. They'll have vertebral defects and they have liver disease also. It is also a positive of bile duct. So bile duct starts, atrophy in the liver, and they also develop like jaundice, neonatal cholestasis. That is, since birth they'll have jaundice. But it is a form of bile duct disease, but it's not biliary atresia.
Great.
Yeah.
What is the detoxification?
And since one more, we have a child now from Kenya.
Yeah. Maybe
Gianna. She is also having bile duct disease. She has Caroli's disease. So bile ducts are abnormal, genetically prone. So her mother Hannah is the donor. So she'll be hopefully. Yeah.
I refer them here.
Yeah. They're doing fine. They're doing better.
Yeah, the baby. When I saw the baby first time in Kenya.
Yeah, she's quite.
Very
Yeah, now she's more alert, more happier, more active. Yeah.
Very active. And I'm happy. Thank you for the good work you're doing for the
Thank you so much.
children and also for my country, Kenya.
No.
Keep it up.
Thank you so much.
And we pray to God to bless you more.
Thank you so much. Thank you.
What you're doing.
Thank you.
Now let's go back to liver detoxification.
Mhm.
What is that?
So see, if you see in the market, they'll say this detox is there, that liver tonic is there. All that is just rubbish.
Mhm.
Okay, what we need to say is have less carbs in the diet.
Yes.
That will help in the fatty liver,
Mhm.
and timely food, which is good for all organs.
Mhm.
And you can have this green tea, lemon tea
Yes.
with honey in the morning. They're
Mhm.
all good detox, natural stuff,
Mhm.
or aloe vera juice. They are better.
Uh-huh. There is tea, there is coffee, there is other.
Coffee.
Are
One
they good
more.
for the liver?
Black coffee is very good for the liver.
Oh, black coffee,
Yeah, black coffee is very good for
not
the
white.
liver. Not white coffee adds calories.
Mm-hmm.
Black coffee is very good.
Oh,
At
great.
least
What
4 5
about
cups a day.
black tea?
Black tea also is fine.
It's
But
fine.
coffee is proven to have better benefit
Better
for the
benefit
liver. Yeah.
for the liver.
Yeah.
Oh, great. That's it's good
Yeah.
to know. Which are the types of drinks that are good for healthy liver?
Drinks means what alcohol drinks are saying.
Yeah, drinks. Okay, in general, they are like juice. You know, people think drinks are
Yeah.
about alcohol.
See, drinks, see, any of these breezers or whatever you say,
Mm.
soft drinks like Coke, Pepsi,
Mhm.
Thumbs Up, all of them have lot of sugar.
A lot of sugar, yes.
And sugar itself is a poison
Mm-hmm.
for the body. It's not good for the heart, it's not good for the liver, it's not good for the kidney,
Mm-hmm.
it's not good for your bones. And slowly, that's how the human body starts dying
Because of sugar.
because of sugar.
Refined sugar or natural sugar?
The refined sugar is worse, natural sugar is better. But sugar is sugar.
But sugar is sugar. So you should avoid sweet things. Okay,
That's it.
good. What about alcohol? Let's talk about
Yeah, it's
alcohol.
important question. See,
It's good to
because
ask because
as a
there are some people
doctor,
who cannot
if I
say
if I
without
say if
alcohol.
I say as a doctor, no alcohol is nobody is going to listen.
Yeah.
So whatever you do in life, you should do with a balance.
Yes.
So for example, any amount of alcohol is not good, to
Mm-hmm.
be very clear.
Yeah. Any
But
amount of.
any amount of alcohol,
Uh-huh.
no matter when you take or how frequently you take, it
Mm-hmm.
doesn't matter. It is
Even one for the
harmful.
road. That's what they say. One for the road.
That's what. But suppose if your family history of diabetes, hypertension, or
Mm-hmm.
like for example, your parents are having diabetes, hypertension, you don't have.
Mm-hmm.
It means you're also genetically prone for fatty liver because fatty liver only causes diabetes, hypertension, heart problem, cholesterol, stroke, everything.
Mm-hmm.
Okay? So fatty liver comes by birth
Bye bye. Mm-hmm.
because the genetic factors.
Yes.
So when, for example, if your parents have one of these things, you will also have fatty liver, even though you're slim and thin built and
Still have
normal.
fatty liver.
But you will have fatty liver if you check your health profile.
Mm-hmm.
On top, when you take alcohol, already you have an unhealthy liver, fatty liver.
Yes.
On that, when you take alcohol, of course you will have damage.
Ah.
So if you have family history of fatty liver, family history of diabetes, hypertension, better avoid
Yes.
as much as possible
Mm-hmm.
because you are prone. You cannot change your genes.
Yes.
Understand?
Good.
But if you don't have that family history and still you have or don't have, but if you want to have once in a while also, red wine is still useful.
Red wine.
Red wine is useful.
But I read somewhere red wine once you take in plenty, you end up having some complications. The liver
I
rejects.
like I said,
Mm.
anything plenty is not good.
Good.
Let me be very
Yeah, so
clear.
people cannot stay without alcohol.
But red wine is meant for social drinking, not for drinking bottles.
There is red wine. And what about white wine?
Red wine is better than white wine.
Okay.
And after red wine, you can say the less alcohol content will be in breezer, or you have less amount of. I mean, usually we should avoid whiskey, rum, brandy because they have a lot of alcohol content.
There are other like gin.
Yeah, gin,
There is
vodka, and all
beer.
even worse.
There is vodka.
Yeah,
There is which one? Which another one?
vodka, gin, brandy, whiskey,
Mm-hmm.
rum. I think I hope I forgot. I didn't miss anything.
It's okay. No, you see, I don't say the brands.
No, not the brand. I'm
Just
saying. I'm
the
saying
in
the
general.
molecule. Yeah.
Yeah, there is a whiskey which is good for the health.
Whiskey, no whiskey is good for the liver.
No whiskey is good. Mm-hmm. Gin, no
No.
gin is good.
Gin, vodka have the highest concentration of alcohol, 70%. 70%.
Yeah, in India.
As per definition,
I don't know.
70%. I don't know what about
the
other.
percentage in Kenya.
Okay.
Because I'm not.
Okay.
You understand. But it's good to know. I want to educate our people.
Yes.
They should know some of these things. So that at least they maintain their good health. No, it's good to know red wine is good. I
Yes.
didn't know today at least.
Yes,
I know.
red wine is
I
better
had
than
someone
others.
telling me red wine is good for the heart. No, today I know it
Yes.
is good for the liver.
It's not
but
good for the liver. It's not. It is
not
less
to blame.
harmful than others.
Ah,
It's not good for the liver.
so we should
The
stop it.
the communication should be very clear.
What if I take grape juice?
Grape juice, any fruit juice is fine,
It's
but
good.
freshly made. That bottled one is not good because full of processed sugar again.
Which any other fruit is good for liver detox?
Avocado.
Avocado.
Avocado is good.
Oh.
Avocado
In India,
is
it's very expensive.
Yeah, I know.
I'm telling. How much do you buy here?
We hardly buy.
I came with some friends. Uh, in Kenya, they implant avocados.
Yeah. Avocado is very good. Avocado is good.
There was a time I came here in India. I passed by Mumbai airport.
Yes.
And I was told that avocado was imported from
Kenya.
No,
Finland.
So it's very expensive.
Very expensive. Yeah.
Very expensive. So
It's not grown here.
Kenya should know that they have golden food.
Yeah, they have golden food.
fruits,
Yes.
avocado.
And instead of rice, you should have more of this millet-based.
Millets.
That's the
Millets,
best. It's a
Kenya,
superfood.
millets, yeah.
Millets is very good.
Millet is superfood.
Millets is superfood. Millets is easy to grow. It's good for the farmers. It's good for the economy, and it's very good for the health.
Millets.
Millets. Any millet.
Wow, that's great. Which any other food is good and healthy for the liver?
See, it's like complex carbohydrates, not simple carbohydrates. Like complex carbohydrates, like all these millets, then any vegetables, all fruits, everything is good.
And vegetables. Great.
Even in meat also, chicken, fish, all meats are fine. Red meat, you need, it's lesser is the better. Because it adds to the calories, it adds to the fat.
There is these gallstones. Are they related to liver?
Yes, like the factory is the liver, gallbladder is a storage organ.
Oh.
So if you are unhealthy, if you have fatty liver, you will get gallbladder stones.
Oh my goodness. There was a time I took so much of milk.
Yes.
And I went to the hospital. They said you might have gallstones.
Gallstones, yeah.
And I had a lot of pain. And after staying for some time, doing exercises, it disappeared. Does it mean I had?
No, because
they never tested.
Yeah.
But
Because
I might have.
possible. Because when pain comes, they suspect stone disease usually. But it's confirmed by doing ultrasound or some blood test. Usually ultrasound is a gold standard for gallstones.
Okay. Let's go back to fatty liver.
Yeah.
Kindly tell us more about it.
See,
because those people don't know about
Yeah. So fatty liver is basically fat deposition in the liver, which causes, first stage is only deposition of fat, second stage is damage, that is called hepatitis, fatty liver hepatitis, and third stage is cirrhosis. Even without cirrhosis, there is end stage liver disease. They can develop hepatitis with liver cancer also in fatty liver. Now that is the liver component. The non-liver component of fatty liver is diabetes, hypertension, cholesterol, heart problems, stroke, all are consequences. So if you treat fatty liver, it's like an insurance policy for all those things.
I didn't know about this. No.
Even gallbladder stones and this PCOD in women, they'll have that, they have infertility issues, abnormal menstrual periods, all that is also fatty liver.
Now, what do you do in case someone has gallstones?
If they have gallstones, first again we see it's symptomatic or non-symptomatic. If they have family history of cancer, gallbladder cancer or not, or if they are from that, for example, in India, there are some regions like Northeast India, Bengal, where this gallbladder cancer is very high incidence epidemiologically. So for them, even if they have gallstones but they don't have any symptoms, we tell them to remove it because of the high risk of gallbladder cancer, and gallbladder cancer is very aggressive.
So if I can get rid of my gallbladder, so I can survive?
If you don't have any stone disease, if it's a healthy gallbladder, you don't need to get rid of it. It's not like an appendix. It does some function. It stores your bile, and when you're eating food, when the food reaches the small intestine, the gallbladder contracts and the bile goes to the small intestine, and that's how your fat digestion, all that happens. So it's a storage organ.
So gall gallbladder releases
The bile,
enzymes,
the bile,
juice.
yeah, bile juice.
We call bile juice.
So when you,
digest.
yeah, that's right.
No.
So liver keeps secreting,
Yes.
but the gallbladder stores it like a tank,
Mhm.
and when the food comes, the tank it empties into the intestine.
Into the intestine.
That's right.
Okay, okay. When someone takes these medicines, we call them proton pump inhibitors.
Yes.
What happens?
It's basically see, God has given acid production to sterilize your intestine. Basically, when you eat food, there will be some germs in that. Bacteria, germs will be there in that.
Mhm.
So that will be cleared, sterilized by the stomach, and
Yes.
that's why God has given acid production.
Yes.
After that, it goes to the small intestine, then large intestine, and then feces, stools. So, but when you take PPI, what people take PPI, that is proton
And they
pump
don't know
inhibitors.
PPI. What is PPI?
Yeah, proton
Tell
pump
them.
inhibitors like pantoside, all those things.
Yeah,
Pantoprazole,
esomeprazole.
osmeprazole.
Uh-huh.
It's rampantly used, which is not good actually, because
Mhm.
when you suppress the acid, first of all, you're causing infections in your gut.
Mhm.
It spoils your gut microbiota,
Yes.
and you start having a lot of constipation, loose stools. You'll have vitamin deficiencies.
Yes.
Over the period of time, your bones start becoming weak.
Yes.
It's called early aging. You start catching more infections,
Mhm.
and it also hampers your digestion.
Yes.
So pantoprazole, all this, any prazoles,
Mhm.
all, like I said, anything you take in limit, it's fine. Excess, it is not good. And for anything, for example, there's nothing called gas. People say, no, I have gas formation, so I'm taking this PPI.
Yes.
It's like because of our irregular food habit. For example, we are all human beings are also evolution from animals actually,
Yes.
correct? So if you look at the human circadian rhythm, you're supposed to finish your day by sunset.
Yes.
Understand? So if you finish your dinner by 7
Mhm.
and morning after sunrise, after your morning exercise and your normal natural calls, you start your breakfast from 8 o'clock, 9 o'clock,
Yes.
and you have that intermittent fasting between night 7 to morning 8. You will not get fatty liver, you will not get diabetes, you will not get cholesterol, you will not get heart problem, you will not get any disease.
Yes.
That is what our ancestors used to follow.
Mhm.
But now we say we are going for nightlife, we're going for clubs, we're going for this, we're going for that,
Yes.
and you start eating your food at 10, 11, 12.
Yes.
Of course, you'll have gas formation.
Yeah, it's true. I agree.
And then you take medicines for that, and that is actually causing you more harm. It's
Yeah.
we are basically rotting ourselves from inside,
It's true. Committing suicide slowly.
committing suicide slowly, having slow poison.
Yeah, it's slow poison. I agree with you.
So
Doctor.
for these many diseases, we need a society approach.
Mhm.
People have to get educated and realize where they are lacking, how they can prevent these diseases.
Yes.
Because and then prevention is cure.
True. Prevention is key. Before we go to this question about liver transplant,
Yes.
I want to ask you about substances or medicine that
Mhm.
can affect our liver.
Yes, like all this herbal stuff, like a lot. See, I practice English medicine,
Mhm.
but herbal medicine are going on for centuries,
Yes.
and the different forms of medicines are there,
Mhm.
different forms of treatments are there,
Yes.
homeopathy, allopathy, Ayurvedic, Siddha, whatever, many are there.
Yes.
But every medicine has an effect and a side effect.
Mhm.
So never use over-the-counter medicines. Always seek your doctor
Yes.
before you take medicines without any reason,
Yes.
and make sure that keep cutting down the medicine. Don't keep increasing.
Yeah.
Cutting
Keep
down on
reducing.
medicines, keep reducing, and remember that if we heal ourselves from inside,
Mhm.
you don't need to take any medicines.
Yes, you're right.
And any medicines will kill the liver.
Mhm.
For even if you take, suppose you're having a headache or you're stressed out, you take a lot of paracetamol tablets. Also, you can cause a liver failure.
Yes. There is this one I read somewhere, acetaminophen.
Yeah, that is paracetamol. Yeah.
That's a paracetamol. Okay.
It's a metabolite of paracetamol.
Mhm.
It becomes acetaminophen, and it's same like paracetamol, only exactly same.
Mhm.
It becomes the metabolite, and metabolite causes the liver failure.
Yes.
We had a patient recently,
Mhm.
a young guy. He wanted to commit suicide, so he took some 20, not 20, around 50 tablets of paracetamol.
Yes.
Then he came they immediately gave him the charcoal over there nearby home, and they brought him here. He puked, but he had liver disease. He had liver damage, but he had a lot of acid production, so we had to do dialysis for him in the night, and then he recovered. He didn't need a transplant because he came soon. If he came after 24 hours, he would have had transplant.
There was a time I was sick. I had an infection. I went to a certain clinic, and I remember I can't remember very well. I'm allergic to amoxicillin and Cetrin.
Yeah. Penicillin drugs.
Yeah, the doctor injected to me amoxicillin.
Ah,
And you know, I
would have had a bad anaphylactic reaction.
I suffered for 15 good days, vomiting.
Oh God, that's very bad.
I was even admitted, but nothing happened. No medicine could clear it. What happened?
See, when you have anaphylactic reaction, your body will start producing the histamines to reduce the inflammation, and it's a general inflammatory response. So when you go to doctor, they will give you steroid to reduce inflammation. They'll give you antihistaminics to reduce pro-inflammatory process, and give some time for healing. But slowly it's reversible. Sometimes it can become very sick that you need ventilator, you need to go to ICU. That is severe anaphylactic shock where the BP falls. But slowly, if the person is healthy, he will recover. If the person is unhealthy or person has cardiac disease, it can cause heart attacks, it can cause stroke, it can cause a vicious cycle. Secondary infections, and they may succumb also.
The question that always disturbs my mind is this allergic reaction.
Yes.
What can we do to prevent it even to other people
Always
suffering this kind of condition?
The treatment for allergic disease is stay away from it. Whether it's food allergy, whether it's medicine allergy, whether it's dust allergy, whether it's pollen allergy, the treatment for allergy is stay away from it. Make sure that you remember that what you're allergic to it and stay away from it.
I'll do that. And also, someone somewhere will understand and know.
Yes, it's very important. Very important. Keep away from it. There's nothing called medicines, like you cannot take lifelong steroids, you cannot take lifelong medicines to treat allergy. There's no treatment for allergy. It's just like your body, you're exposed to that substance before in your childhood, that you developed immunity against it.
So you cannot take, for example, I'm allergic to eggs.
No, you cannot take egg.
But if I take egg,
you will get allergic reaction. If you have, sorry.
It can even kill.
Yes, that's true. It can even kill.
Let's go to the topic liver transplant.
Sure.
What is liver transplant?
So in liver, like I said, the different causes for liver damage, when they become end stage, that is irreversible damage, that is called cirrhosis, or they develop liver failure, or they develop liver cancer, or they develop symptoms of liver disease that it is causing them lesser chance of survival, we offer liver transplantation to them. It can be children or it can be adults. In children, no, like I said, liver is a factory for the body. So even in children, even though they have good liver function, but structurally they have liver disease, they don't grow. They don't grow in height or weight, and they become stunted, and they have poor school performance, and they don't become normal adults. Like for example, girls will not achieve puberty. So for them also we offer liver transplantation for children. For example, LFT is normal, so everything is okay. It's not okay for children. Adults it's okay, not for children. So the outlook is different. And in liver transplantation, what we do is, first step, we explain the family that, see, this is the stage of a liver disease. This is what we can do medically to stabilize the disease, but it's not going to cure it. So liver transplantation is the only solution for that. Second step, we do pre-transplant evaluation and see whether the patient is medically fit for the operation, and patient will have at least 90% guarantee after operation. Then we take for the operation after the patient is medically stabilized, and then in the operation we remove the bad liver and put a portion from the donor, because the liver grows like hair. You cut your hair, the hair grows. You cut your nails, the nails grow like that.
And it
The
will go
only
to
organ,
normal size
that's right. It grows to complete normal size in 3 weeks time.
in 3 weeks' time.
That's right.
So soon.
So soon. It's a natural phenomenon.
Oh
From the
my
portal
goodness.
vein
I
flow,
didn't
it
know
happens.
this.
Yes, in 3 weeks time it
Three
grows.
weeks time.
The liver grows back to normal, both in the patient and in the donor.
The same size. Oh.
And the volume will be exactly same as before because the volume is based on their body metabolic rate.
Yes.
So volume will be same as before. So donor is not a patient. Donor safety is utmost importance,
Yes.
and donor risk is only 0.1%. So 99.9% no risk to the donor.
Yes.
So we also check for the donor, their basic metabolic profile, the health checkup, everything is fine. They're completely fine, technically fine, medically no issues. Then only they proceed for donation. We never say, see, you have this problem, we'll treat you and then you donate. It never happens.
Yes.
Because the bottom line is donor is not a patient.
Can a donor donate liver twice?
No.
Once.
That's a good question. That was the ancient Greek story
Okay.
where the eagle kept eating, the vulture kept eating the liver and the liver kept growing.
Yes.
That's a Greek tale.
Yeah.
But only once you can donate, not again.
Only one chance.
Yeah, only one chance.
That's great. I have a disturbing question,
Yes,
and
please.
to so many in the world, about human organ trafficking.
Yes,
Is
it is disturbing.
the liver one of the organs that are said to be?
See, organ trafficking is more in kidneys.
Mhm.
Liver is relatively less because liver is a big operation.
Mhm.
They have a big scar, and they take some more time for recovery. Kidney removal is much easier.
Yes.
It's maybe a 45 minutes job
For the kidney.
for the kidney
Mhm.
for removal. But yes, organ trafficking does happen in liver also. Fortunately, we have never seen that situation and we don't want to see, because in the end we want to do good service
Yes.
in a set of rules.
Yes.
And this liver transplantation or organ transplantation is a science. It is not some kind of business.
Yes.
It's science. It's only to change human lives and make it better.
Yes.
So we will never ever cross that boundaries.
And
it
it's
is
not traded for money. It's donated
never,
for free.
never. The donation happens from a loved one only to save their family,
Yes.
not for organ
For
trafficking.
any, you cannot
Not-
donate to anybody.
You cannot donate to anybody.
Uh-huh.
The government clearly says without relation, you cannot be an organ donor. If you, for example, you're
Here
a friend
in India.
in India, yes, this is what we follow. Very clear. If you're a friend or you're adopted but you don't have adoption papers, or you're staying with the family since beginning, since childhood, you're polite family,
Yes.
all that business doesn't work in organ donation.
Oh my goodness.
They
I
have to
didn't
be,
know. I
they
thought
have to be,
anybody can
no. They
donate.
have no
Only
question.
a brother or a relation.
Only a family relation only
Family.
can. That's all.
Relation.
Without relationship, no question of donation. No question.
Oh, that's great. There is also this issue about lifetime after removing the liver
Yes.
from a donor to the patient. How long can the liver stay outside the body?
Usually the cold ischemia time, that is when we remove from the, for example, in a brain dead donor, that is cadaver transplantation. Usually they say up till 12 hours you can keep in ice, but if you do within 6 hours, the better. Within 3 hours, the best.
3 hours.
Implantation, yeah.
So it should be done immediately.
It should be done immediately.
No wastage.
No wastage. Then liver doesn't work after that.
Not like the heart, 4 hours.
No.
Or even
Within 3 hours.
3 hours.
Even heart, all organs are like that. The more you wait, even if you wait for the kidneys also, they don't start functioning. The patient doesn't start passing urine. They need dialysis and all post-operative.
Yes.
So always, the lesser the time for implantation, the better it
The
is.
better.
Definitely.
That sounds good.
Definitely.
Yeah, to save the life of these patients from the donor.
But in live donor, it happens immediately.
Yes.
Within you can say within 1 hour.
1 hour. That's great.
Yeah.
What
Because
if,
both operations happen parallelly. That's why.
yeah, it's true. What if the liver fails to match with the patient from the donor?
I didn't understand.
I'm saying, what if the liver does not match with the patient's
For the donor.
blood. Yeah, from the donor.
See, usually in liver transplantation, only blood group compatibility is more than sufficient.
Oh, blood group is enough.
Yeah.
That can tell
But now the science has evolved in such a way that our team does different groups also.
Mm-hmm.
For example, a patient has AB group.
Yes.
Any blood group, A, B, O, all are okay for AB group.
Mm-hmm.
But suppose the donor has AB group,
Yes.
but patient is O group.
Mm-hmm.
The patient needs only O group.
Only O.
But if we have developed this set of protocols where a different group like B group can give to O group, A group can give to O group, that also we do.
Yes.
But we follow some protocols for that
Mm-hmm.
to see that patient will tolerate a different group.
Yes.
And if the patient is medically fit for that kind of operation only, we offer them that we can do different group also.
Yes. No artificial liver?
Artificial liver, there are different devices are there like liver dialysis, plasmapheresis. They are called extracorporeal liver support systems.
Yes.
That's only as a bridge to transplantation, that to make the patient better. Like we have a patient now in ICU. He came with acute and chronic liver failure with a jaundice of 35 milligram per deciliter. Normal is 1 to 2,
Yes.
less than 1.2 actually. So we did plasmapheresis for him, brought down his bilirubin to 20. With that, the kidneys have started recovering now.
Yes.
So now he's being planned for transplantation once he's little more better.
Oh, that's great. Now, there is the kind of machines, the modern machines that you use to diagnose liver diseases. Which are these machines?
Diagnose.
Yes, to diagnose.
Yeah, one is fibroscan. Fibroscan is like ECG. It's a simple test which we do from outside where it will tell what is any damage in the liver and how much is the fat content. Then second, ultrasound. These are very basic tests, liver function test. Then next comes CT scan, MRI. Sometimes you can do MRI elastography. That will also tell the stiffness in the liver. So these are mainly the machines what we use. Endoscopy, suppose when you have liver disease, you'll find changes in the intestine, in the stomach.
Yes.
That time we see endoscopy and
So endoscopy is so helpful.
Yeah.
I'm a victim of atelectasia cardia.
Oh, okay.
And I was treated by Dr. Sane here.
Oh, very nice, awesome.
For 15 years.
So you did poem?
Post Heller's myotomy.
Heller's myotomy.
Did not want to work well for me. I came here. That's how I came to know Kim.
Oh, awesome.
And I can tell you, it's a progress and I'm happy. That problem went away.
Wonderful.
Surgery is good.
Awesome.
No, why I'm saying endoscopy
Poem,
is
yeah.
of great use to me.
Yes.
Now, what about the treatment assisting machine that you use actually to treat some of these diseases?
See, like I said, we have plasmapheresis. What in our ICU we use, we have plasmapheresis, we have CRRT, dialysis machine, by which we support the kidneys, clear the ammonia. Suppose the patient has come with acute liver failure.
Yes.
We first intubate them, put them on ventilator, paralyze them so that the brain gets rest.
Yes.
And then we start them on dialysis, that is continuous renal replacement therapy, by which we start reducing the ammonia, and then we we make sure the brain is not affected, and in the right time we take for transplantation.
Yes.
So that is CRRT. Second, CRRT. Second, if the patient has come with acute or chronic liver failure or acute liver failure or progressive liver disease with high bilirubin and other organs are getting affected, we do plasmapheresis or rat all poisoning, the rat poison intake.
Yes.
That also causes acute liver failure. For them, plasmapheresis works like wonders. Without transplantation, we can pull them out.
Yes.
So these are some machines, and we have TEG, that is that coagulation profile machine. How to assess the coagulation index.
Yes.
So like that, multiple gadgets are there.
That's great. It's good to know some of these machines.
Yes.
Now, for how long have you been in this specialty?
Like I said, 15 years.
15 years. There is someone in Kenya or in
Yes.
Africa
Yes.
who wish to be a doctor like you.
Yes.
A hepatologist.
Yes.
How do you advise this young man or this young lady?
See, what I will say is, my passion was to actually do gastroenterology, but then at that time I saw this new specialty which is rising, and you can say destiny that I landed up in this specialty, and now gastroenterology, in the end, whatever specialty we choose, We have to have passion in that.
Yes.
Or even if you want to do doctor, you want to do engineer, you want to do journalism, you want to do anything in life, have that passion automatically and put that hard work. God will give us the way, and we will do definitely well in that.
Good. I'm happy, and you have said passion.
Yes, it is true.
Passion will move everything.
Absolutely.
And will make someone to be whom
Yes.
he or she wants. Or
Absolutely.
what is your hobby?
Hobby. When I was in my college days, I used to play guitar.
Mm-hmm.
I used to be a Western solo singer.
You're a
We used,
musician.
yeah, we used to have a band,
Mm-hmm.
and that was my one passion.
Yes.
But after I became busy in this clinical work,
Mm-hmm.
I lost touch.
Mm-hmm.
Second, I play some sports like badminton. I play cricket,
Mm-hmm.
and I love swimming.
Yes, swimming.
Yeah, I
Great.
love swimming.
Mm-hmm.
So these are some of my hobbies.
Wow, that's nice. What kind of a car do you drive?
I have a Skoda. It's a small car.
Scooter.
Skoda.
Skoda is an Indian model.
It's a Czechoslovakia.
Great. Skoda.
Volkswagen.
But in India, I have seen you have small cars.
Yes.
Why?
I think because the roads are small and the population is more.
You don't like big cars? Doctors. I don't
No,
want to say
because
that.
it helps in navigating through the narrow roads of India.
Yeah, of India. And mostly use motorbikes, scooters.
Yeah, that is much easier.
Ladies,
Even
yeah,
parking.
Yeah,
Parking
even
is easier.
Is a challenge. Yeah, but when you go to Kenya, you want to show you have a big car. As a doctor.
No, here also they take big car when they want to go on long road trips, but in the city they prefer smaller cars.
Okay. And they're economical.
Yeah. And no, it's secondly, it's easy to navigate in the roads.
So you don't have a big car? I thought doctors should have big cars.
No, Skoda, it's a big car only.
Why? I know it's a big car. Skoda is good.
Yeah.
I've seen it in Kenya. Also
Yeah.
saw it here. But mostly in India, Suzuki. Hyundai,
Yeah, Maruti
Kia.
Suzuki, yeah.
Yeah,
Kia,
Suzuki is in plenty.
Hyundai,
Yeah.
yeah.
Oh, that's
Tata.
great. And Tata is your brand.
Yeah,
Yeah, we have, in Kenya, Tatas are heavy trucks.
very nice.
Very nice.
No, very good trucks, yeah.
Yeah, they're
Very good, yeah.
And very economical.
Yes.
We also have Leyland.
Ashok Leyland.
Ashok Leyland.
Ashok Leyland.
Made in India.
Yeah.
Thank you so much, Doctor.
Thank you.
And we
Thank you,
invite
Samuel.
to Kenya.
Yeah.
People,
Sure.
encourage your people.
Yes.
See your children there.
Yes.
I know baby Gianna will be fine.
Yes,
All shall be well.
sure.
Thank you so much.
Thank you so much. Thank you. Nice meeting you.
Pleasure.
Pleasure.